Good evening, Mono County, and thank you for joining our community conversation for August 6, 2020. My name is Brian Wheeler from Mono County Public Health, and I'll be your host this evening. I will once again be joined by county officials and officials from the town of Mammoth Lakes and representatives from Mammoth Hospital. We have a lot to cover tonight, so I will turn it over to Stu now for a presentation. Go ahead, Stu.
Thank you, Brian. Welcome, everybody. Thursday, August 6th. Again, we're just going to run through a brief PowerPoint presentation. Again, the goal of our community update each week is to really open it up for a conversation. So we want to make sure we leave plenty of time for your community questions throughout Mono County. So with that, going to kick things off. Again, same topics as we provide each week. We're all in this together. We'll do some case stats as of 5 minutes ago. We'll update you on a new health order, on gatherings, where we are on the path forward, and just a brief community update. And we'll kind of cover the latest testing schedule for next week. So again, stay safe to stay open is our hashtag campaign. Again, it's more than just a hashtag. It's really a new way of life, change of behaviors, making sure that you're covering up throughout Mono County. They're required throughout the county and the state of California. And then again, we really invite you to encourage and showcase your safe practices in and around the county to keep our local businesses open. Again, you'll see our distinctive flyer, banner, and poster throughout the county. So this recent order was published on July 31st by Dr. Boo. It's really to clarify the gathering order. It's consistent with the state. And again, just three main bullet points here. You can see it on the directives page for the portal. But again, gatherings of persons from different households remain prohibited, regardless of size. Religious and cultural gatherings may only be held outdoors. And then wedding ceremonies shall be restricted to 30 people. And that includes the wedding party and guests. There is a prohibition on receptions at this time. Again, that would be construed as a gathering. So again, a look for the order on the directives tab on the portal. And again, you'll see it in the key topics on the website. We're just going to bump into the latest case statistics. This is as of, 5:15 this afternoon. We just bumped up a little bit to 152 cases. That's a 26 increase in cases from this time last week. You can see just a little kind of steady bump over that period of time. Again, you can find this statistic and that graph on the case stats update. The 7-day metrics, this was as of a couple of days ago. Sorry, this was of Wednesday when Public Health pulled these statistics for us. We tested 367. We had 32 positive cases. Again, a little decline from last week. And that's a positivity rate of 8.7%. County metrics in regards to positivity rate. You can see we started a month ago, 4.29, escalated quickly to 11.32, declined last week to 6.7, and now we're settled just above the state threshold of 8%. We're at 8.72%. And then we included the status of the Mammoth Hospital on this slide. There's a green, yellow, red status. And at this time, I'm going to ask Dr. Burrows, the Chief Medical Officer, to provide a brief update on the status and what it means at the Mammoth Hospital. Dr. Burrows.
Thanks, Stu. So hello, everybody. So the hospital has created a color-coded system to try and report what the capacity of the hospital is to be able to take care of patients, not just COVID patients, but really all comers, including COVID patients. Green is probably pretty self-explanatory. It means that we're able to take care of anybody. Yellow means that we are approaching capacity, and red means that we are now at a crisis level of hospitalized patients, where specifically with COVID patients, we may have difficulty in caring for them with adequate resources to be able to take care of them. Over this last week, we actually went from green to yellow for the first time since we created this system for one day. I'd like to assure everybody that the reason that we did that is not because we have been inundated with patients with coronavirus who are now being admitted to the hospital. What it ultimately was, we came to a point where we realized we need to accommodate a bigger overall volume of patients that are coming into the hospital. As anybody who lives in town is aware, we have a lot of people in town. And like most summers we've had over at least the last 5 years, we're seeing that reflected in people presenting to the hospital for any number of reasons related to mountain biking accidents or traumas, or literally stepping out of your trailer and breaking your ankle, or being sick with whatever you're sick with on a regular basis. Because of that, we have seen a pretty healthy volume of patients unrelated to COVID. But when you couple that with COVID admissions, of which we have had about one a week for the last 3 weeks, we wind up doing a lot of shuffling to try to make certain that that patient is being taken care of in an area of the hospital where we're not contaminating either other patients or staff or anyone else in the hospital. So what happened over the last couple of days is we decided we were going to have to change to yellow because we literally were shuffling to move people around to keep everybody safe. We have long since established a plan where we reassign different parts of the hospital for patients depending on what their COVID status is to accommodate just that. And we basically needed a day to shuffle back to that plan because we know we're going to continue to see COVID patients. We want to make sure we have a place to put them along with the patients being admitted for other reasons and not have to worry about what comes down to playing musical chairs every time that situation arises. So the long story short is no, we did not see an abundance of COVID patients admitted to the hospital. We just went back to a plan that accommodates our ability to take care of everybody.
Great. Thank you, Dr. Burrows. And
Yep.
Dr. Burrows will be with us for the duration of the call. So if anybody has any follow-up questions, make sure you pop those in the Q&A. The next slide we're just going to run through is a slide that we have been included in the presentation for the last couple of weeks. This is the 14-day positivity rate per 100,000 people. So if you look at Mammoth Lakes, the county total, and the unincorporated only, you can see the 100 number is the threshold for the state that triggers the monitoring list. You can see the county now is at 436, and Mammoth Lakes actually declined from 740 last week down to 655. So we'll keep showing you that graph. Just want to update you on testing. You know, the last couple of weeks, the Public Health Department has been really focused on contact tracing, testing restaurant employees, and then the referrals and symptomatic patients from the 211 line. So next week, August 10th and Wednesday, that will still be the case. But on Thursday, August 13th, between 10 a.m. and 1 p.m. at the Mammoth Lakes Community Center up there on 1000 Forest Trail next to the tennis courts, you are able to come and get tested. We are limiting tests to 100 per day. So again, make sure you do get there early. And then for those latecomers, try and arrive prior to 12:45 if there are still tests available. If you've actually had a test and you haven't received the test result, please call the health department, and that's a number there, 760-924-1830, and be prepared to leave a message, and then staff will return that call. The other option for testing is with Project Baseline, the Verily testing program. They do drive-through testing every Tuesday at Mammoth Lakes, and then we are scheduled every Friday at Lee Vining High School. Lee Vining High School is also the opportunity to register on site. So it's a great opportunity as well. They do prefer you to register online, which is the link right there. Testing is at no cost for individuals, and that's regardless of your insurance status. And you can see the upcoming dates. This Friday, Lee Vining, next Tuesday, Mammoth, and you can see again the following Friday and the following Tuesday. All this information is found by clicking on this Get Tested Today graphic on the home page of the website. So look for that information on the website. Just a quick update on the town assistance programs. Again, we haven't got an update from the county on their programs yet, but we do want to say that the round one of the business assistance program awarded just under $100,000 to 11 qualified businesses. Round 2 has received 9 applications, and that application period closes this Friday at 5. Again, that's a $300,000 program. The rental assistance program managed by Mammoth Lakes Housing. Again, you can see mammothlakeshousing.org or call 934-4740. Have paid 608 rental payments over the last few weeks. And that is upwards of $302,000. There are still funds available, and you can apply up to 4 times. And again, this is from Patricia. Plenty of remaining funds for those in unincorporated areas of Mono County, June Lake, Lee Vining, Walker, Benton, and other communities. So please do reach out to Mammoth Lakes Housing. Again, this is our updated, sorry, not updated. This is our slide for our local resources information. We have bilingual websites. Again, any question that's not answered today, please email us at covid19help@mono.ca.gov. And you can see here, you've got numbers on the hotline, code compliance, code violations for the county. And again, the daily brief. This is a really comprehensive, thorough brief issued every Tuesday and Friday. And you can see that on the COVID portal here. And our next community conversation will be on Thursday, August 20th. We're going to take a break next week. Again, we'll be back on Thursday, August 20th. Again, English at 5:30, Spanish at 6:30. Brian, with that, I'll send it back to you. Thank you.
Thank you, Stu. Struggling to find my mute button there, as we all have during this era of Zoom meetings. There is a fresh face with us today that I just want to make everyone aware of. Chief Rebold is getting a little R&R this evening, so we have Chris McCrasick, who is our acting chief, sitting in. So, Chris, would you like to say a few words to our group?
All right. Well, thank you for tuning in this evening. I hope we're able to answer a lot of your questions. I know there's a lot of questions out there. We're working very hard at the Emergency Operations Center, to take care of all the needs as far as with the businesses, with personal protective equipment, trying to meet the needs of those that end up quarantined or in isolation. So our real, priority and purpose here is to really take care of the community and the community as a whole. So thank you for having me here this evening.
Thank you very much, Chris. Also, Lauren won't be with us tonight. She's also getting a little R&R, so Justin will be serving as our host. So take it away, Justin. Let's start with our first question.
Great, thanks, Brian. First question. What progress has been made regarding the ongoing discussion that is apparently going on about scaling back nightly rentals?
Rob, are you able to speak to that? Or Dan?
Let's jump to Dan.
Okay. I didn't see you on there, Dan.
Thanks, Brian. I can speak to that. Dan Haller here with the town of Mammoth Lakes. Yeah, it's been an ongoing discussion in terms of scaling back nightly rentals. Based on a variety of discussions with lodging owners, we will be presenting some draft information to a business roundtable tomorrow, which would look at kind of locking in the 24-hour vacancy requirement between stays before we add limits on that based on when reservations were taken. So that would become a mandatory requirement, looking at starting in August, the 24th, I believe, is the current proposal. Give people a chance to be able to respond to that a little bit. We're also making it very clear on some of the other requirements that deal with laundry issues, dealing with cleaning of appliances, those types of elements, highlighting some of the other optional areas, both in the state guidance or in our current guidance, that would make what would appear to be optional items, make them requirements within that, and also looking for some enhanced messaging that would require people to let folks know they should have a reservation before they come up, that leisure or vacation travel is still a strongly discouraged from the state order, a stay-at-home order that's still in place across California, and some strong messaging of that perspective out there for that. The hardest thing probably is looking at a timeline to keep these things in place. looking at potentially through December. It does not really trim back the number of people coming into the area, which is still a significant concern. So it could be revisited here in the future again, should like it's creating more of a challenge for us in terms of the number of people in town and mingling and cross activity of people, if that impacts our case rate. It's a tough issue looking at the impact that the visitors are having coming in for that time frame. We do know that some disease elements do come in through that process. How much is difficult to measure. We're also anticipating we should see a natural decline in the number of people coming in from a vacation standpoint as we move into mid-August and then into the fall season. If we continue to see large levels of crowds, we'll obviously have to revisit those discussions. And I'll defer if Dr. Boo wants to speak to that as well. It's been a back and forth issue we've been working through, or Rob, if you want to add to that as well. Rob?
Yeah, so I can add there, Brian, you're coming off of mute. So while Dan and Dr. Boo have been working on how to enhance the, or I guess revise the order on short-term rentals, me and my team have been working on ways of enforcing that 24-hour rule in between. Dan just alluded to the fact that the new set of orders will probably stop the grandfathering in of no break between stays that were booked prior to June 19th. So a lot of calls have come into my team about folks that are going back to back. We've done some extensive research on many of them, finding that some of them were booked prior to. We did develop a nice audit program, though, that we can go out and request calendars and information from folks that believe to be are violating that and working through the enforcement cases on that. So we're working hard on that side of it. That's what we've been focused on.
Thank you, Rob. Thank you, Dan. Would anyone else like to add to that? Nope, Dr. Boo's shaking his head no, so we're gonna move on to the next question, Justin.
What, if any, clarification after testing results and research will be offered to the community regarding the restaurants that were closed to dispel any further rumors of restaurant spread? Also, aside from closing restaurants immediately, what other precautions, disinfecting, protection assistance is offered to respective restaurants?
Dr. Boo, would you like to field this one? On mute, Dr. Boo. Oh, looks like Dr. Boo's having some technical problems.
It looks like somebody unmuted me. I couldn't get anyway. So, yeah, for restaurants, we will share information such as, the number of restaurants that had positive, cases found in them with the testing and, the overall percentage. We're still trying to tally up that data. Some restaurants, apparently sent their folks to Verily and others, kind of as planned to the public health testing. The results are relatively reassuring to me so far. There's a significant percentage of people who came out positive, but it's not a overwhelming percentage. It's a percentage that's in line with the percent positive rate for the state of California, our preliminary analysis of it. But we will share more information. It's just taking a little bit longer than we might like to get it all together.
Yep, thank you, Dr. Boo. A lot of results, a lot of tests we did. And another part of that question was what needs to be done for restaurants when there is a positive case. And we do ask them to initially close for 24 hours for deep cleaning and disinfecting. And that also gives our EPI team a chance to start the investigation and identify contacts and get those individuals quarantined. So I hope that answers the rest of the question. Justin, can we move on to our next question?
Is the county or the town pursuing any rapid testing for residents?
Ooh, I know this has got you written all over it, Dr. Boo.
Yeah, can you hear me? I'm still having
Yep,
problems.
hear you.
Can you hear me?
Loud and clear.
Yeah, okay, so the hospital has some rapid testing that they're still validating, and we'd like to get the same thing for county public health use. One of the antigen tests that has an emergency use authorization approval from the FDA. They're not quite as good in some respects as the PCRs, but they're pretty impressive, and it's one of the few tests that have come out so far that can be used outside a hospital with an official approved lab, but it's turning out it's quite difficult to get. The demand is very high, and in fact, I was on a conference call with the state health department today, and the state health department is recommending that jurisdictions around the state pursue this kind of test, and so I don't know how feasible it's going to be or how soon we'll be able to get something, but we're working on it.
Thank you, Dr. Boo. Dr. Burrows, do you have anything you'd like to add to that?
Hang on one second. Oh, sorry. There we go. Yeah, I was going to say the test, as Dr. Boo was referring to, seems to be in more plentiful supply than the other tests, which we were all anticipating we were going to be used and have unlimited supply. So in that regard, it's very good because we can get the result within 15 minutes of doing the test. One of the other advantages of it is it does not have to be pushed all the way to the back of your throat, which is called the nasopharyngeal swab, which for anyone that's had it done, myself included, it's pretty uncomfortable. The other one literally just goes in the middle of your nose. It's very easily tolerated, and again, you get the result pretty quickly. In the setting of someone that is truly symptomatic with coronavirus, it's very reliable. The difficulty with that test is after a few days, that test will be negative. That doesn't mean that you were exposed or weren't exposed. It also doesn't mean that you wouldn't be positive on the PCR test. The PCR test is a lot more sensitive and will be positive for a lot longer. But certainly in the context of, are your symptoms because of coronavirus and are you still contagious? It's very helpful to know that that test is either positive or negative, because a negative test really means you're probably not contagious anymore. Even if the more accurate test is turns out to be positive several days later. And I apologize, that's a super confusing explanation.
Thank you, Dr. Burrows. Justin, should we move on to our next question?
Sure. Sticking with this theme, I was tested by Verily on July 14th, along with 2 other people that I know. As of this minute, we have not received results. Have emailed them twice. My question is, why is the county offering worthless tests and our insurance being billed? The results are worthless at this point.
Chief McCrassick, I know you've been working with Verily. Can you address this question?
We definitely understand the frustration and the time it's taking to get the results back. The labs that they're using are backlogged. We looked to Verily when they came in to help augment our testing. We kind of had to halt our pop-up testing to take care of the contact tracing. I know that Verily is only going to be here just through the end of this month. But we have been working with them, contacted them, and are pushing them along to provide the quickest test results that they can. So we're frustrated with everyone else, but we're definitely, aware of it and working with them.
Chief McCrassick, Verily has reached out to other labs to try to use more different laboratories, that wasn't so good, but is that the case? Are they trying to contract with multiple labs now to speed up the process?
They are. They've piloted contracting with some other labs in the Central Valley, and apparently it's going okay. I don't know when they're going to be able to, expand that to this side of the mountains. But it's a huge issue. It's a statewide issue. All I can say is, yeah, I mean, a test that you know, you don't get a result back within 2 weeks or longer is of little use. And I just kind of, I don't know, keep my fingers crossed and hope that things get better. You know, with passing weeks, and I think their contract to you know, to do what they do to provide testing services has been extended at least through September.
All right. Well, thank you, Dr. Booth. Thank you, Chris. Can we have our next question?
Obviously, not enough enforcement of public health and resource protection laws and policies have been done with the extreme levels of visitors. It is scary and frustrating. What is the town and county planning to do to mitigate this?
Rob, would you be able to address that? Or at least start the conversation?
Yeah. Well, as Dan talked about just a minute ago, we were talking about additional restrictions on the short-term rentals. That's been in place or been in discussion now for the last 2 to 3 weeks, really just looking at what can be the most effective in slowing down the visitation. I think the messaging that's going out now, basically saying, have a reservation, have somewhere to stay before you come up, you know, almost to a degree of don't visit. I don't know if we've gotten that far yet on our MLT outward messaging. But we're aware that it's challenging. I think what we're seeing from folks is that months long of pent up in their homes, quarantining away from everything else, and people are just out and about. The work that we're doing is to make sure that people, certainly within the businesses and the restaurants and things like that, are doing everything that they need to be doing to protect the employees from coming in contact with so many people. But that's kind of the extent of it from a standpoint of working to curtail the lodging a little bit, but also just making sure we're doing everything we can to keep everybody protected and following those protocols.
Thank you, Rob.
You know, this is Tom Boo again, and I just think it's important to also, you know, I mean, you know, we're the Unified Command for COVID, you know, EOC, and I think it's important to make a distinction between, you know, the questioner, the question referred to not enough enforcement for public health orders and also for natural resource protection. And I see the natural resource issues, while I care about them personally, as being totally outside, you know, my area of responsibility or in my wheelhouse, as it were. And so there's a strong tendency, I think, to lump all this together. There's a lot of people, and there's, you know, public health concerns, and there's, you know, too many people on our favorite trails, and concerns about impacts from, you know, from irresponsible camping and fire risk and stuff. But they're separate issues in my mind, and I'd like to maintain that distinction for our discussions. I mean, there's people on this call who, you know, are, you know, maybe do have more sort of responsibility or authority over some of the non-COVID things, but this discussion is supposed to be focused on the pandemic. So,
Okay. Would anyone else like to chime in on this topic?
You know, Brian, it's hard to chime in and add context. I appreciate Dr. Boo's comments about the natural resource side. I didn't pick up on that within the question. The town has recently expanded our code compliance to cover some additional wildlife gaps that we have out there. And we've also, this person now is working within the Lakes Basin on the weekends, issuing tickets and things that are out there. So we're aware of it. We're working on that. We're working on additional restroom capacity within the town. We're seeing a lot of challenges with that because restaurants are not open, and other establishments that would have provided places for restroom usage. So we're aware of that. We're working on it, but again, not COVID related.
Thank you, Rob.
To add to that quickly, Brian,
Sure.
the Forest Service has ramped up their elements. They only have 2 law enforcement agents on the whole Inyo National Forest, but they are using fire protection officers who are out patrolling, looking at especially the dispersed camping areas. Especially at night, they go out in the evenings and stuff when the illegal fires are much more visible. And so they do provide a lot of education through that process. They do write citations. and obviously have people put out fires or destroy fire rings as well as are there. Our code enforcement officer has done some similar work that way as well in the lake space as far as illegal camping and illegal fire pits. So it's an area that we're concerned about as well. And to the total number of people coming into our community based on traffic counts and other data we have really does not show a large amount different than last year in comparing traffic data. You know, traffic count into town through July at 395 primary access and was actually a few cars less than a year ago. So we haven't seen a dramatic increase in traffic counts. Occupancy levels dropped about 5% from July this year to last year. So that's been down. And so I think we're seeing some other second homeowners that own places here coming up and staying longer potentially. But traffic counts are not showing a high dramatic increase in people, nor is the occupancy levels that we're seeing in our lodging properties. More people are recreating in our area, I believe, in part because of restrictions into Yosemite and some other restricted areas there. So we are seeing probably more people in Mammoth Lakes out seeing things. We're seeing a lot of first-time visitors. And so all of those elements are in there. And as Dr. Boo alluded to, you know, there's one impact that deals with that on our environmental side. The other two pieces to that really come back kind of rolling up being our economic viability here in the community. But over all of that is this public health pandemic as we're seeing the COVID-19 impacts. And how do we make sure we keep that as a top of mind issue, be that through people, through gatherings, through good public processes with people behaving themselves. And that's really a primary focus of where we're at, trying to balance off those other needs with the priority of our public health system and the health of our community.
Thank you, Dan. I see Ingrid's been waiting patiently with her camera on, so go ahead, Ingrid.
Sorry about that. I don't really have much to add. Chief Davis and his crew have really stepped up enforcement in the Lakes Basin and the increased presence, and we're doing the same on the sheriff's side, and we are getting an increased number of calls for fires, campfires, hazards, fireworks show last weekend. That was spectacular. But we're working on it, and we're responding to it and telling people to put out their fires and educating them. The Humboldt-Toyabe, I believe, is about to go into fire restrictions as well, so that'll now be countywide. There is no campfire while you're camping. I know that's hard for people to understand, but it's an education process, and we're getting there and talking to people. But I can confirm what Dan Holler said about traffic data. We're not seeing more cars. It feels like it. It really does. But when you look at the numbers, it's not. It's pretty flat compared to last year, maybe down a smidge. But it does feel like a lot more people. I think because we're looking for it. It's kind of a little bit of confirmation bias. So, and I appreciate it. Call it in. If you see something and you see something that's a hazard, give us a call and we'll go out there and we'll handle it. But we need to know about it. So tell us. We're more than happy to answer the phone and send somebody out there.
Thank you, Sheriff Braun. Chief Davis, did you want to add anything to Sheriff Braun's comments?
Not particularly. She covered everything, and the lake space and stuff has been covered. So no, we're good for the time being.
Okay, thank you, Chief. Justin, can we have our next question?
Sure, I'm going to combine a couple here that are related.
Okay.
If all it takes is lower volume summer patients to move the hospital to yellow, how will the hospital deal with expected flood of non-COVID patients over Christmas? In addition, what are the town and county doing to prepare to move businesses indoors?
Go ahead, Dr. Burrows.
Yeah, again, I thought I tried to explain this, and I know it's confusing, but our hospital is a critical access hospital designed with a relatively low number of beds, and we have to report based on what our status is at the moment. So to say that we were green when we're shuffling patients around is not true. That is a guideline and not an absolute as far as when we're reporting. And again, we're green right now, but we're green because now we have moved back into a situation where we're anticipating we're going to have COVID patients along with medical patients and surgical patients. And for that reason, we've now reestablished a ward that can handle in much bigger capacity without having to shuffle resources or staff to do so. So I guess my answer for you is when we come into the winter, if we have to keep our layout and our format the way it is right now, then that's what we'll do. We are more than capable of handling that load of patients. It was just a question of pulling a trigger and saying, you know what, we have to go back to the plan of being able to accommodate those people and creating the physical space and resource allocation to do so.
Thank you, Dr. Burrows. Justin, can we move on to our next question, please?
There was a second part to that question,
Oh.
which was, what are the town and the county doing to be proactive about bringing businesses indoors during the winter?
Dan, would you like to address that from the town side?
Yeah, this is Dan Holler again. The challenge for the winter coming in is, it's frankly, I would say it's even before then, it'll be this fall when it gets dark early and it cools off in the evenings. The challenge we're running into, it'll be working with our state partners and really trying to have that dialogue being the closing of the indoor activities. How do we get permission to move them back indoors? It might be at a lower capacity, other modifications that may need to be made there, but it's not just a town or county decision. It needs to be made in partnership with the California Department of Public Health as well, whose regulations and requirements have put in place moving different things outdoors. And so it's an ongoing discussion. It's one that we're having in other communities as well as we start to look into a cooling off timeframe as we get into the fall, into the winter season, where the outdoor activity does not work well. The alternative that becomes very creative in how you end up either trying to provide heating components or other elements, and it will be extremely, extremely difficult.
Thank you, Dan. All right, Justin, can we have our next question?
How many positive tests have been done on non-mono residents? They don't seem to show up on the local statistics, but each non-resident who is here and is positive is also a local health concern.
Absolutely, and you won't see that on our count. Those cases are typically, unless it can be, equivocally proven that it was contracted here, those cases are assigned back to the county of residence of that individual. As far as how many, I don't have an exact number. I would guess, though, it's somewhere around 10. Dr. Boo, would you agree? It's somewhere around 10. Dr. Boo's shaking his head.
Yeah, that'd be my guess. Yeah.
Yeah. All right. Can we have our next question?
Sure. I'm trying to combine a few here. Social distancing is oftentimes non-existent in Vons. Is the town pursuing any restrictions for the number of people allowed in a business at a time?
Was the question, is the town pursuing?
Correct.
I can
Go ahead, Dan.
I can speak to that briefly. We've had that conversation with Vons, both at the local management level as well as regional and corporate in the state. We're not there yet to really count that, as we have been monitoring Vons. We go into it for people from the town at different times of the day and stuff. You do see now and again a group of folks coming in, or a little bit of a crowd, but for the vast majority of the time, at least that we've been able to do the spot checks, we haven't seen significant violations in the social distancing component. People are pretty well behaved at that point. We have asked them to take a look at what would it take. If you had a limit on that, our biggest challenge is the layout of the parking lot and the outdoor area for safety of managing people, and then having the staffing out there to make sure the line itself doesn't turn into a gathering point for going into the store. And as I mentioned earlier, with the winter season coming on, having people standing out at night, basically, if that's part of the challenge, or late evening, has its own challenges in terms of weather as well. So difficult position to be in. We've asked that management there to watch that, and the extent that they can help kind of guide some of that, even to, if you can make the comment, if you have a large group walk in, the question is, do you need that many people from a group to be in shopping? We've had those questions come up. Again, we see it more of off and on type of an impact versus an ongoing challenge throughout the day. So it's a little harder to regulate at that point.
Thank you, Dan. All right, Justin, let's have our next question.
Now that Inyo County has an outbreak at the care center with 2 new deaths, how do we know if any of the positive or exposed staff from there are not working in Mammoth?
Dr. Boo, would you like to field that one?
Sure. Yeah, there's good coordination between Mono and Inyo, and there are some cross-border links. There's some people that live in Mono and work at the care center, and there's people in Mono who are quarantined and isolated related to the care center outbreak. But we work very closely with Inyo County Public Health.
Thank you, Dr. Boo. Justin, can we move on to our next question, please?
Can Mammoth Lakes Tourism take down ads on Facebook encouraging tourists to come to visit?
Rob or Dan, would you like to field that one?
This is Dan. Yes. In one sense, yes, they can take down ads. They can do those types of elements. What we've really tried to drive with MLT and their ad work to date has been focused on driving people to a landing page. It really talks about responsible tourism, talks about responsible activities within our environment, and focused in that area more so than a direct invite here, come up to Mammoth. We're having discussions right now with them on modifying some of that messaging, looking at the idea of, don't come up without a reservation, travel with people of your own household, potentially restating the governor's order and those types of elements. So it's a question of what type of marketing message is there. They have dramatically dropped back in terms of any spending on marketing. I think last year at this time, for the summer, they'd spent about $400,000 in total of marketing plus dollars for air service. Currently, it's running about $55,000 is all for marketing spend that's out there. And a lot of that has been focused on, if you see the various posters out in the bus shelters in those areas that are trying to direct people to responsible activities and kind of obeying the COVID-19 guidelines and those types of elements that are there. So a lot less spend on that. And again, I think that as we look at a lot of the data, it doesn't seem that folks are necessarily coming here based on the marketing side that MLT is doing. A lot of, I think, is just a broader knowledge of Mammoth in general from historical advertising. Plus, we're also seeing people come up this summer that are normally just coming up in the winter. They already know about Mammoth, but they've made that decision to leave wherever they're at for whatever reason to come up here for a period of time. A number of people say it's the first time they've been here in the summertime, normally being winter visitors.
Missed the mute button again. Thank you, Dan. Justin, can we move on to our next question?
Please explain the reasoning behind not allowing gatherings, but packed restaurant patios are fine.
Dr. Boo?
Yeah, so in part, that's simply the state order. In theory, so restaurant patios are not supposed to be packed. They're supposed to be spaced. And remember, the people at those tables are not supposed to be gathering. We're supposed to be limiting it to a single household. But, I think we all recognize that that's really difficult or impossible to enforce. But the fact is that gatherings are really, like just, having friends over, going to visit your sister out of town or relatives coming here. I mean, mixing of households and mixing of people from different jurisdictions, they really are a significant driver of the epidemic in California and nationwide and presumably here in Mammoth and Mono County. Probably the majority of new infections occur within households, but there obviously have to be infections occurring between households, in order to have introduced into a household. And so gatherings are a big part of that. And again, the only the order that I issued last week, it really was just trying to clarify and restate the state position on gatherings. There was a widespread misconception that gatherings of up to 10 people were allowed, and that hasn't been the case since Governor Newsom issued the stay-at-home order, back in mid-March. The only thing that new restriction that I introduced in that order was putting a size limit on weddings. Weddings are allowed by the state, and there was some discussion that we should limit that to some moderate number. And so, I selected 30 people for weddings, and wedding receptions are not allowed. So just clarifying those things.
Thank you, Dr. Boo. And I can concur from what I've seen from our testing results that there does seem to be a fair amount of spread in between family members household members at this point in time. Justin, can we have our next question?
Have numbers in a plan been set forth as to when the town would choose to limit, restrict? How many positive cases will be needed? What percentage per day per capita does the town deem necessary to take further action? Have numbers like this and scenarios for action been discussed?
Well, it's kind of a town and county question, but go ahead, Dr. Boo.
Yeah. I was pretty set on placing some more restrictions a couple of weeks ago when our cases were rising so quickly, but they seem to have, it's too early to tell, but I mean, this past week they kind of plateaued. If the graphs that Stuart showed at the beginning. Sorry, it's hard to talk here sometimes. Yeah, I mean, there's metrics that we put out there, the percent positives and things, but the most critical things to me, I think, are if we're starting to have more people with severe disease and the hospital's being impacted, and we're just, clearly at risk of losing more lives in town, or the contact tracing teams are just overwhelmed by the numbers and can't keep up and can't quarantine and isolate the people that need to be. Those would be probably the most concerning metrics or indicators to me. And they're a little bit soft. We put some numbers on it, but I mean, in a way, it's a subjective call. And I'm encouraged by the possible plateauing that we're still getting more cases than we'd like to see, but it's it's not continuing to go up like this. It's kind of leveling off a bit, and so we'll keep a close eye on that and take action accordingly.
Thank you, Dr. Boo. And that does seem to be a pattern of states in different areas plateauing at a high level, and we're not at an extremely high level, but certainly higher than we were. Justin, can we move on to our next question?
Were any clusters found with the restaurant testing indicating spread within the workplace?
Dr. Boo, would you like to field that one?
Yeah, or that data as well as I do.
I do.
There were a number of clusters over months where there were numerous people found in one restaurant to be positive, but then there were also people in outside the workplace that were contacts of exposed to the restaurant workers. So yeah, I'm sure there's some degree of spread within the workplace, but sometimes it's pretty hard to define whether infections are occurring solely within the workplace or whether coworkers are hanging out as well outside the workplace. So I think it's a combination of when we have these clusters. I think it's a combination of transmission inside and outside the workplace. And I'm optimistic that the increased attention, the higher level of face coverings, and asking the restaurant community to double down on screening for illness and educate their workers, will have some impact. But I do feel less concerned that that our local problem is really concentrated in restaurants. I mean, I think it's concentrated in the essential worker community, and that cuts across numerous sectors.
Thank you, Dr. Boo. Justin, can we have another question?
Are the 13 north and central cases in Bridgeport? Why not report specific towns?
That question again.
We've been round and round on that one, but it's just it's a legal issue, and it's based on the very clear advice of county lawyers, county council, following standard guidelines based on population that we should not release data when the towns, the communities are so small, and that's why we divided up the county into the regions that we have for reporting purposes. And the federal law that we all are concerned about here is it's called HIPAA, and we're talking about protected health information. And yeah, you can argue that sometimes it maybe seems a little over the top, but it's the law, and we're going to follow it.
Thank you, Dr. Boo. And Justin, can we move on to our next question?
A lot of the questions are related to short-term lodging and tourism. I think we should maybe address this one. Tourists haven't proven to be responsible, so how do you expect them to follow the guidelines?
Dan, Rob?
Well, one of the things that we're doing, certainly, I know when we get calls about issues with respect to tourists, that we are getting out there and trying to address that. I will agree it's a challenging thing. If you think about people who are on vacation, oftentimes they forget about all rules, and they're up here just to have a good time. So we really, it's that continuing conversation with them that occurs at the establishments they visit within town. When people go to retail or restaurants or things like that, they're reminded of those things. But it is an inherent problem that when people are on vacation, they're really not following as many rules. But we've got, as Dan said earlier, we've got MLT giving good guidelines around what it means to recreate safely, what the expectations are when you come to town. There's some really nice messaging and posters out there that really talk to that. And that's other than just meeting with folks and enforcing things when we see them in larger groups and such. That's really about the extent of what we can expect on that. But I think that continuing sort of bombardment, if you will, from the places that they do visit in town is helpful.
I could add to that, the premise of the question a little bit. We see a number of people that live here and locals that are here that behave poorly at times as well. It's not just a tourist-based challenge there. We do see people coming up, and they are on vacation. They're here to have a good time. They're out there. They're having a great time. We see, a large majority of them, as we're out, are recreating responsibly. Obviously, we have some that are not obeying the rules and some bad actors out there. But complaints that we get in other areas also deal with locals as much as, or maybe not as much, but definitely we have complaints regarding how we as residents here and locals here behave as well. So our admonition to everybody would be is that personal responsibility to be able to stand up and say, yes, I'm going to obey the rules. It's there seems to be at times a license for speeding applies to locals, which I can have the sheriff or the police chief speak to that as well. But just simple rules of that nature, and being kind and looking out for the good out there, and modeling the behaviors that we want those who visit our beautiful area to follow as well. So that would be on all of us to be able to do that, be it wearing a mask, be it obeying the various rules, be it social distancing. I think we need to model that behavior that we want our tourism-based population and those who really support our economy to be doing. So I think it starts with us, and then ongoing messaging out for those folks who are visiting. Thank you.
Rob. We're going to go to Al Davis and then Sheriff Braun. I see they've turned their cameras on, so go ahead, Al.
Well, even just basic, speed laws, rules of the road, all the things that people are dealing with their whole life seem to go out the window when they come up here. 35 miles an hour on Main Street and somebody got a ticket for doing 82 on Main today. So it's all rules, but now these are all new rules, and they're not informed. We try to inform them, but they just do their own thing. So it's with new rules, that makes it even harder because they won't even follow the old rules. Sheriff?
And this isn't new. We have this every year. People come up here and they think, I have a 4-wheel drive. I can drive in the snow, but they don't know how to drive in the snow. And it has nothing to do with COVID. It has to do with going on vacation and checking your brain in big time. And we do it too. When we go on vacation, we are distracted. We're looking around. We're human beings. We're fallible. So people are on vacation. They make mistakes. They need to be educated. They need to learn. But the COVID part is statewide. It's pretty much nationwide. But statewide, there are masking orders. There are all these orders statewide. So when they come here and they say, oh, I didn't know, well, they did know, because the orders are here and the orders are in Nevada too. So if they come from Nevada and they say, well, I'm from Nevada, well, guess what? You have that order in Nevada too. So that I didn't know excuse doesn't play. But I'm on vacation excuse, I forgot excuse, that's every day, every year here. We live in a tourism town, and tourists, they're not paying attention. They're on vacation. They've checked their brains. They're not here to pay attention and follow rules. So it's our job to inform them of the rules and enforce the rules. So if you're doing 82 on Main Street, you just earned yourself a hell of a ticket, and pay it, because fighting it's not going to do you any good. So we are enforcing the rules. We're not going to catch everybody all the time, but remember that they're tourists, and be kind, be nice, be the good example. Pull your mask up, do what you're supposed to do. Pick up a piece of trash. Yesterday on our Facebook Live that we did with the new normal thing, people were like, I don't have time to do that. Well, you have time to rant on Facebook. If you have time to rant on Facebook or rant on Instagram, you have time to pick up a piece of trash. Do one little thing. It'll make you feel better that you've done your part. And then we can all be a little bit better human beings for it. Be nicer, be kinder.
Thank you, Sheriff Braun, and thank you, Chief Davis. Let's see, we have probably time for one more question, Justin.
Sure, I have one I can combine. This is a request or a question as to how the number of 30 participants was selected for the wedding ceremony order, as that approaches and is in line with restaurant capacity.
I can address part of that. As we looked at modifying that, we had several questions come into the EOC and to individuals of us asking about the size on weddings. We had reached out to some of the event folks that coordinate some of that, looking at sizes and also the various locations and managing that. And so it was tied back to the information we received there, and also just looking at it as a smaller group of people on purpose. As any wedding, you have a couple different things happening there. One, they need to have space so they can meet the 6-foot social physical distancing element between households. Excludes the bride and groom, by the way. They also need to be able to manage it from a parking standpoint. And just as people show up and they go to an event in a place, you're trying to get that whole separation and elements throughout the wedding experience. And then we do not allow the receptions or parties before and after, and those types of elements, which are more difficult. And so by managing that smaller group, you help manage those issues. And then I guess the other side to that was looking at a lot of the weddings, we're inviting a lot of people into town, across families and everything else. The smaller number tends to limit that invite out of the number of people that are coming into the community. That multi-household mingling element that we talked about as being a challenge. And so some level of data from people helping with those, and then just some practical levels of pieces that you begin to look at how do you manage those types of events. And Dr. Boo, if you want to add to that, that'd be great. Otherwise, yeah, it was a couple different factors going into it for that number.
All right, thank you, Dan. And Dr. Booth, did you want to add to that, or no, you're okay? All right, well, I want to thank all my panelists and thank all of the viewers for tuning in. That's all the time we have for tonight. So until we see each other, I think on the 30th, I believe is the next meeting. Is that correct, Stu?
20th.
August 20th, Brian.
August 20th. I was off by 10. Anyway, we'll see you
2 weeks.
August 10th, August 20th. Until then, take care of yourselves and each other. Good night, Mono County.